Welcome to Chapter 13, Evaluation and Overview. Based on planning, implementing, and evaluating health promotion programs by James McKenzie, Brad Neiger, and Rosemary Thackeray in public health, evaluation is essential. It helps us understand whether our programs are working, how they can improve, and whether they deserve continued investment. Let's begin by defining what evaluation means. Introduction to evaluation. Evaluation is the process of determining the value or worth of a program based on predetermined criteria. First is evaluation helps improve program quality. Second is it helps determine effectiveness, whether goals and objectives were achieved. Health education specialists play a key role in planning, conducting, and reporting evaluations. This chapter provides a foundation for understanding different types of evaluation, their purposes, and how to apply them effectively. Basic terminology. Understanding the vocabulary of evaluation is the first step to using it well. Evaluation means assessing a program's worth using established standards. It's systematic, evidence-based, and tied to outcomes. A formative evaluation. Formative evaluation is conducted during program development and early implementation. First is it helps improve design before full rollout. Second is it answers, is this working as intended so far? It informs adjustments before it's too late. B. Process evaluation. Process evaluation focuses on how the program was delivered. It measures implementation fidelity and process objectives. First is it tracks participation, attendance, and delivery. Second is it helps explain why a program did or didn't succeed. Third is it differs from formative evaluation because it usually occurs after or during delivery, not during planning. Some criticize programs that only evaluate process and ignore outcomes. See summative evaluation. Summative evaluation occurs after the program ends. Its goal is to determine effectiveness. First is it requires baseline and post-test data. Second is it includes both impact and outcome evaluations. Third is it's essential for accountability, funding decisions, and scientific knowledge. The impact evaluation. Impact evaluation measures immediate observable effects. These may include behavior change, knowledge improvement, attitude shifts it helps answer. Did the program influence short-term outcomes? Outcome evaluation. Outcome evaluation assesses long-term goals. It may examine reduced disease rates, lower mortality, improved quality of life. This is the most rigorous type of evaluation and the hardest to achieve. Purpose of evaluation. Evaluation serves many purposes. According to Capwell and colleagues, there are 6 general reasons to evaluate. First is to determine whether program objectives, especially health status goals, were achieved. Second is to improve how programs are implemented. Third is to provide accountability to funders, communities, and stakeholders. Fourth, to build community support for the initiative. Fifth is to contribute evidence to the field of public health. Sixth is to inform policy decisions at all levels. Evaluation is more than just a requirement. It's a strategic tool for improvement and legitimacy. The CDC Framework for Program Evaluation. The CDC's 6-step framework is a widely used guide. Each step helps make evaluation systematic, meaningful, and useful. Step 1. Engage stakeholders. Involve people who care about the program. Include funders, participants, staff, and community members. Understand their perspectives and what success means to them. Step 2. Describe the program. Clarify the program's mission, goals, objectives, and activities. Use a logic model to outline inputs, outputs, and outcomes. This gives evaluators a shared language and plan. Step 3. Focus the evaluation design. Define the purpose of the evaluation. Develop research questions and hypotheses. Choose the type of evaluation and data methods. Decide who to study, when, and how. Step 4. Gather credible evidence. Choose indicators that are valid and relevant. Collect data that is high quality, sufficient in quantity, and ethically gathered. Decide on your data sources, tools, and timeline. Justify conclusions. Compare results against benchmarks or success criteria. Interpret findings, judge value, and make recommendations. Include fidelity assessments and strategies to increase objectivity. Step 6. Ensure use and share lessons learned. Make sure the findings get used, not just reported. Tailor reports to each audience, funders, staff, policymakers, or the public. Close the loop by feeding lessons back into future programming. 4 standards of evaluation. At the center of the CDC framework are 4 standards. First is utility. Does the evaluation meet the information needs of those who will use it? Second is feasibility. Is the evaluation realistic, cost effective, and appropriate for the context? Third is propriety. Is it ethical, fair, and respectful to all participants? Fourth is accuracy. Are the findings correct, valid, and reliable? These standards help ensure quality and trustworthiness. Practical issues and barriers. Many evaluations fall short not because of bad intent but poor planning. Common problems include: first is failing to plan for evaluation from the beginning. Second is not allocating enough time, staff, or budget. Third is small or slow program effects that are hard to detect. Fourth is short program timelines that don't allow change to happen. Fifth is difficulty linking cause and effect. Sixth is differing opinions about what success looks like. Anticipate these barriers and plan around them. Key considerations in planning and conducting evaluation. Evaluation in the planning stage. First is design your evaluation plan while designing your program. Build in baseline data collection and early feedback mechanisms. Formative evaluations improve the intervention before it's too late. Summative evaluations must be planned for validity and objectivity. B. Ethical considerations. Ethics must guide every evaluation. First is do no harm, protect physical, mental, and emotional well being. Second is obtain informed consent and protect privacy. Understand the difference between anonymity and confidentiality. Third is use institutional review boards or IRBs for oversight. These principles come from the Belmont Report and guide all health-related research. See who will conduct the evaluation. You have 2 main options: internal evaluation, done by staff inside the organization. Advantages: low cost, insider knowledge, easy communication. Disadvantages: bias, conflict of interest, external evaluation, done by a consultant or university partner. Advantages: objectivity, broad expertise, greater credibility. Disadvantages: cost, less program familiarity, choose based on your goals, budget, and evaluation needs. Look for training, experience, and credibility when hiring externally. External evaluation also offers opportunities for publishing and dissemination, de-reporting, and using evaluation results. Evaluation doesn't end with data collection. You must decide. First is who will receive the results: funders, administrators, staff, or the community. Second is how will you use the results: revise the program, advocate for funding, or share lessons. Third is how will you report them: narrative, infographic, executive summary, or full report. Evaluation is a cycle. Use results to improve your next effort. To summarize Chapter 13, first is evaluation determines value, worth, and effectiveness. Second is formative, process, impact, and outcome evaluations serve different purposes. Third is the CDC framework provides a 6-step model for high-quality evaluation. Fourth is utility, feasibility, propriety, and accuracy are key standards. Fifth is anticipate practical barriers and plan for them. Sixth is ethical standards must always be followed. Seventh is choose between internal and external evaluators based on your needs. Eighth is reporting and using results ensures your program improves and your work is not wasted. Thank you for watching this video. This concludes Chapter 13, Evaluation and Overview, based on planning, implementing, and evaluating health promotion programs by James McKenzie, Brad Neiger, and Rosemary Thackeray. Stay tuned for Chapter 14,